Women's Health Victoria established the Victorian Women's Health Atlas in 2015. The motivation for doing so was the fact that there was a lack of sex disaggregated data on women's health and gender equality in Victoria at that time. And there was also limited funding for and prioritisation of women's health.
The Victorian Women's Health Atlas is a free public website that maps over 75 indicators of health and wellbeing for every local government area in Victoria. The Atlas makes it possible to tell the story of gender and health equality across the state. So what's the story for women compared to the story for men? What's the story by geographic area? And what's the story over time? And the idea of that is to help inform service development, policy and planning at statewide, regional and local level. And the Atlas also has a whole lot of outputs to help aid in the knowledge translation. So we have maps, graphs, fact sheets and different trend charts and a gender analysis to help frame the data.
Before the launch of the Atlas, the 9 regional Victorian Women's Health Services had to be able to kind of get data about their regions. They needed to go to different data suppliers and platforms to bring that together, which was a very time-consuming and costly process. So it was decided that a more efficient and sustainable solution would be to have a single online platform with data across the whole state as well as at the LGA level. And this was able to then not only support the Victorian Women's Health Services to do the regional work, but also to kind of support advocacy, service planning and policy across the whole state in relation to women's health. So the Atlas has improved accessibility of data on women's health and gender equality across Victoria. And as a free resource that caters to multiple skill levels, it has really reduced barriers to accessing the data contained on the platform.
Initially our core users were the women's health services across the state and they have remained core users throughout. Then more recently the Atlas was a recommended resource for local councils in preparing their municipal health and wellbeing plans and to support their work in gender equality and prevention of gender-based violence. We've also had the Commission for Gender Equality in the Public Sector recommend the Atlas for use by entities reporting their obligations under the Act. So they may have to take account of gender in reporting on different programs and services. And we also have the Victorian Women's Health Program, which is a Department of Health program that actually determines what we do and the Women's Health Services. That now has specific objectives and outcomes for the Atlas that we have to deliver on. And we also have evidence from an evaluation we did recently of increasing use in the health services sector and in the education sector, secondary and tertiary level. Usage of the Atlas has continued to gradually increase over time. As at 2024, we've had over 30,000 visitors to the site and over 300,000 page views. Spatial Vision provide platform hosting for the Atlas and they also provide technical support. And that frees us up to concentrate on sourcing the data and curating the data, which is a massive job in itself. So they have the expertise to do that and we don't have to worry about that. They've also supported us with enhancements and evolution of the platform over the years, while remaining true to the original principles that underpin the design. And that design was done by storyboarding with the different women's health services. What did we want this platform to deliver? What stories did we want it to tell? And some of the enhancements we've brought in over time are things like the time slider feature, where you can slide through the years and all the maps will automatically change. A measure called Compare Measure, which allows us to throw up any 2 maps side by side to visualise the differences. We also have fact sheets for every local government area that automatically populate and update with every update. Therefore we need to do no formatting, it just takes away all of that work that people used to try and do. And more recently, we did a project to add confidence intervals to about a quarter of the Atlas, a very painstaking project involving redesign and a whole lot of rethinking about our displays, which we've done. So over the years, Spatial Vision have become a really trusted partner with a really cooperative approach to problem solving, and also providing us with cost-effective solutions for what we need.